So one of the main challenges with masks is knowing how to wear them. So the first mask I want to begin with is the N95 mask. Generally, you wear the N95 mask when you think you're going to be in an area with prolonged exposure to people who may have the coronavirus. If I'm going out in the general public, I'm probably not going to wear the N95 mask. But if I'm working in the hospital, nursing homes, I'm going to be wearing an N95 mask because number one, I don't want to get the disease, and number two, if I potentially have or am carrying the disease, I don't want to give it to any patients. So the N95 mask is a pretty tight-fitting mask. It is more difficult to breathe in an N95 mask, and it's not something that anyone is accustomed to wearing for prolonged periods of time. Generally, in healthcare, we wear these when we go into the patient's room that has a respiratory disease, and then we take them off when we come out. Now, today, most physicians in hospitals and healthcare workers in hospitals will wear this mask continuously because we don't know where the virus might be or who may have the virus. When you put on an N95 mask, you want to make sure, or you put on any mask for that matter, you want to cover both your nose and mouth. And I'll tell you why in a little bit. But basically, to put on an N95 mask, you go ahead and you put it over your head, and then you want to make sure that it generally will have a metal or a device here that you can pinch down to really cover your nose so that no air is escaping above. You want to bring the strap over your ear and then under your ear. And then you want to make sure you have a seal beneath your chin and all the way around. That's why a lot of people when they wear this for a prolonged period of time, will get a little bit of a rash, acne, or they will just get like some imprints in their face from wearing this because it's a tight-fitting mask. Do I want to wear this going out into the general public for a prolonged period of time? Probably not. This is probably should be reserved for healthcare workers working in healthcare conditions. Some people, if you do have this mask available to you and you are wearing it and maybe you have pre-existing conditions, that's fine. This is how you want to wear the mask. You do not want to wear a mask like this, where you're only covering your mouth, and you don't want to wear a mask like this. I've seen this as well, where you're only covering your nose. So that's the N95 mask.